Hello and welcome to APTA's live event on safe sports participation during COVID-19. I'll be your host and moderator. My name is Hadiya Guerrero. I'm one of the physical therapists in the practice department at the American Physical Therapy Association. As the country reopens, anxious coaches and athletes look to return to more regularly scheduled and sports-specific practice and playing. The United Nations writes on May 15, 2020, that the Olympics and Paralympics, for the first time in the history of modern games, have been postponed and will be held in 2021. So where does that leave the rest of us? As movement experts, physical therapists are well aware of the benefits of physical activity of any nature, and those benefits that have been linked to sports participation specifically, including mental health benefits, leadership characteristic development, and chronic disease prevention, or at least derailment. And for some, socioeconomic upward mobility. The World Health Organization and Physical Activity Guidelines for Americans recommends that people do 150 minutes of vigorous or moderate intensity of exercise a week. Yet we are concurrently impacted by the COVID-19 virus and its imposed inactivity. Further, Psychology Today reports Americans are facing even more increases than what occurred in the 35% increase from 1999 to 2018 in suicides, due to prolonged economic stress, social isolation, loss of community and religion. So it seems time to talk about safely getting back to physical activity, and in this case, sports for those with and without disabilities. We have a great panel here for you today, and I'll introduce them one by one. First, I'd like to introduce Katie Lucas. Katie is a postdoctoral associate at the Kentucky Spinal Cord Injury Research Center in Louisville, Kentucky. Katie graduated from the sports residency program at Cincinnati Children's Hospital in 2013. She is a national track and field classifier, as well as a regional wheelchair basketball classifier with the United States Olympic and Paralympic Committee. Katie is the current chair of the APTA's Adaptive Sports Special Interest Group within the American Academy of Sports Physical Therapy and treasurer of the Biomechanics Special Interest Group within the section on research. She's an item writer for the Specialization Academy of Content Experts and is on the 2020 President's Council on Sports, Fitness, and Nutrition Science Board. Her research interests include motor control in sports and rehabilitation with a clinical interest in endurance athletes, youth athletes, and athletes with disabilities. Welcome, Katie. Our next panelist is Sarah Reinking, who is a board certified physical therapist at Children's Hospital, Colorado, where she also serves as the sports physical therapy research lead. She was a collegiate soccer player at St. Louis University, where she also attended PT school and graduated in 2014. Sarah then went on to complete the sports physical therapy residency at Cincinnati Children's Hospital Medical Center in 2016. She is the current communication co-chair of the American Physical Therapy, American Academy of Sports Physical Therapy Concussion Special Interest Group. And she has presented both locally and nationally on several topics, including sports-specific rehab following ACL reconstruction, examination and evaluation of functional low back pain in the adolescent athlete, and return to sports following lumbar spine injuries. Her research interests include outcomes following ACL reconstruction, with a particular focus on the role fear has during rehabilitation, as well as risk musculoskeletal injury following concussions. Welcome, Sarah. And we have Jim Zachazewski, who is currently a physical therapist and athletic trainer with the Brigham and Women's Hospital Department of Orthopedic Surgery, Division of Sports Medicine. He has over 40 years of clinical, academic, and administrative experience in different settings, including traditional athletic training settings, faculty, teaching position, and various clinical sites. Zach has worked as a physical therapist and athletic trainer for the 1984 and 1988 Olympics, and has traveled with US diving and US figure skating synchro. He has authored or edited 6 textbooks centered on sports rehabilitation and has multiple peer-reviewed publications to his credit. I'd like to welcome you, Jim, and our panelists today. So let's dive right in. I'd like to ask each of you to take 2 minutes and just tell us about where you are practicing and what state, where your state is in the phases of reopening with respect to the coronavirus, and what populations you either study and or work with. Katie, I'll start with you.
Hi, everybody. I'm Katie Lucas. I'm in Louisville, Kentucky. I just finished my PhD at the University of Kentucky, and so I'm a little bit in a transition right now. We're in phase 3 in Kentucky, so we're starting to see more things open and people outside and getting around a lot more recently. And I've worked with people of all ages, but have much more experience working with kids, and then experience with working with kids with disabilities.
Thank you, Katie. And James, I'll have you go next.
Hi, thanks for inviting me on the panel. I'm in Boston. We are in phase 3 currently, and I think on the downtrend or at the low end of COVID right now. I think we've kept things in pretty good control. So we're being allowed to go into phase 3. Currently within the orthopedic department of Brigham, I'm working a lot on infection control standards for coaches, athletes, return to sport, athletic training venue sites, athletic healthcare centers, and the like. My experience ranges from pediatric athletes through masters and professional and international level. So this has been a challenge for everybody. And I think the big challenge right now that we're facing in Boston is how to get back to activity. Gyms were just allowed to open on Monday here in the Commonwealth of Massachusetts. But it's how to get back to activity, how to get back to organized activity, and especially in the school setting and collegiate organized athletic setting. And then that'll trickle down to teams and youth leagues, and how do we do that and do that safely in this new normal that we're facing.
Thank you. And Sarah.
Hi, thanks for having me on. So I am in Denver, Colorado, and I work as a part of the sports physical therapy team at Children's Hospital of Colorado. So I primarily work with 8 to 18-year-old athletes all day long, and it's really fun. We here in Colorado are transitioning towards phase 3, but we've had an uptick in cases the past 3 weeks. So the bars and restaurants that were set to open are now closing again, some of them. And so we're kind of on the upward trend here in Colorado. So, but yeah, like I said, I work with kids all day long, and I love my job. So I'm really happy to be here.
Thank you all for those introductions. So I want to start with a general question and ask, in your communities locally, are you seeing people go back to playing sports in your community? James, I know you mentioned that the gyms just reopened. And if so, what does that look like? And what would you ideally like to see?
Go ahead.
I'll just start that off. We have some, as of June 1, we had some youth sports camps that resumed. We had a limit of campers per group. And also we did restart some youth recreational leagues. Groups up to 25 people can be on the field, or, you know, on the or on the baseball field, whatever. I do know that as far as like some high schools go and some weight rooms, kids are signing up for weight room time. So there are limited amounts of kids in the weight room at the same time. And practices as far as, and I can speak for my athletes in particular, some baseball and swimming athletes, practice sizes are limited as well. So there's multiple practice sessions per team. So that's kind of where we're at here. So it's slow. I know there are some travel tournaments that were occurring. The last I heard that some of them were canceled recently in states that they're really seeing a big expansion of cases like Arizona. So yeah, that's kind of where we're at here as far as sport goes.
Thank you, James.
Some of the gyms, as you said, are starting to open and hopefully opening safely with hand hygiene and cleaning and all the aspects of preventing transmission of COVID or any kind of influenza type infection. I was at the gym earlier today. I'm currently in therapy for a knee injury. So doing some aquatics and in a pool that was sectioned off with ropes so that you could get 8 people in the pool at the same time, but that was it. So, you know, I think everybody's looking to modify. I've seen group classes with people separated by 10 to 12 feet, looking, as Sarah said, to minimize or decrease the size and the number of individuals that are there. And I think as this first starts, it's trying to adhere to that. And then how do you work with that, especially in the youth sport? It's hard to get an 8-year-old or a 9-year-old not to go buddy up with somebody. It's hard enough with an adult who, you know, should have the ability to listen. But it's harder with some of the youth. And I think there's a big challenge that's going to be there for all coaches and moms and dads and administrators of youth league programs, as Sarah alluded to with some of the stuff that's gone on in Colorado and Arizona.
James, could you touch on if you've noticed in the aquatic setting that you mentioned, even in your therapy, are you observing any regular cleaning of the communal surfaces while you're actually swimming, or do they circulate you in and out as a group and do it between your sessions?
Well, it's both. I mean, flotation devices or resistance devices, whatever you might be using in the pool for therapy or for exercise, are cleaned by the staff after you're done with them. There's no transmission based upon WHO and CDC guidelines. There's no transmission of the COVID virus in the water. There may be relative to air exchange and particulate, and that's why they've got the area roped off, so that I probably had, for my exercises, I probably had a 100 square foot area. So think of exercising in a 100 square foot room. And somebody else had the next room, the next room, the next room. And we were distanced apart within that. No masks because of, you know, the intensity of the exercise one might be doing. So you've got to look at whether or not you should use a mask in that case. So that's what's going on there. But certainly things were clean. The locker rooms are clean. But you also have to use your own personal discretion about, are you bringing wipes with you? Are you bringing hand sanitizer with you? Whose towel are you using? How are you cleaning up after yourself, and taking some personal responsibility for that as well?
So were there added ladders that each of you got out the pool a different way, or the same one?
It was steps. You walked up and down the steps which were in the water. So there's a railing and they'd clean the railing, but we weren't going up and down ladders. But any equipment that you had was cleaned by the staff after you gave it back to them once you got out of the pool. Thank you.
Katie, what are you seeing?
Yeah, so we had some gyms open a couple weeks ago that were really restricted in the spacing that was available, in times that people would have mask only, like strengthening periods of time. As of July 1st, I've seen more teams that are starting to get together. And it's interesting kind of the areas that are picking up a little bit faster than other areas, where there's some parks and areas that are more spread out, and you can see people are really doing a good job, but they're starting to get more populated. So things are starting to kind of pick up. So it's an interesting position that we're in right now. Our numbers have ticked up a little bit recently, and it seems that people are maybe the last couple weeks not quite as careful as they have been. And so Kentucky's kind of figuring out what they want to do with that. So we'll kind of see what our governor is thinking on that. Yeah, and then for weight rooms, people are cleaning it as they're going. There's usually 1 or 2 people coming through, making sure everything is as clean as it can be.
What sports have you observed?
Soccer, cross country, the ones that are outside more than anything are the ones that I feel like we're starting to see in our area.
Katie, before we had this session, we had discussed that there were some concerns around seeing an uptick in injuries in the fall. Can you give me some more insight of what your concerns are from a physical therapist perspective and someone who's worked with athletes, of what concerns one should be mindful of and consider following this pandemic and going into, let's say, fall sports?
Mm-hmm. And I'm sure that everybody has insight into this. I'm sure it's not something that I'm the only one kind of concerned about. But what we've noticed for just in general fall seasons, when strength and conditioning is extremely important. It's for every season, but I feel like we see it in the fall the most, where people who may not have as many opportunities to do strength and conditioning and having some of those practices, if that time period is not really available, or it's smaller, or people are not as active, there's always an increase in injuries the first 2 months of returning to the sport. So there was an article in 2011 that looked at the NFL and Achilles injuries, but I feel like every season we see that with youth sports, and ACL injuries is the biggest group that I feel like we see every single year. And I'm sure Sarah can allude to that even more. But it's not only ACLs, it's not only fall sports. Kids have been in a situation the past couple months, along with all of us adults, where it's high stress. There's not a lot of activity. Kids don't quite understand what's going on sometimes as much as, or we try to protect them, and sometimes it actually makes it worse, their anxiety on what's going on even worse. And so I think right now, as from a injury prevention standpoint, from a health promotion standpoint, and from just making sure that the kids and athletes are in a good situation moving into the fall, I think this is an area where PTs can really step up and help out their communities.
Any thoughts, Sarah or James, on the considerations as we returning to fall sports?
Yeah, I totally agree with everything that Katie said. I think kids are going to be really, really excited to get back to their sport, really motivated, really ready to burn off some energy that's probably been stored for the past 4 months. And so I think it'll be really, really important that both, coaches, athletic trainers, parents are cognizant that there still needs to be a gradual return to avoid especially overuse injuries we see with growing kids and open growth plates, bone stress injuries, stuff like that are all things that we're going to need to be aware of as they get back. I mean, that's always a thing when they return to sport, but we've had this period of prolonged inactivity that is going to make it much more likely that it happens unless there's a systematic way that they're returning. There are so many ways right now, even if, sport isn't happening yet, to get kids active at home without overdoing it, but kind of preparing their bodies to start that activity in the fall. And I think, like Katie said, this is a time when physical therapists can kind of help guide, whether it's in the clinic or it's just within our community, how kids can, be safe when they return. So.
Jane, oh, you're muted.
Sorry. Echoing what both my colleagues said, I think one needs to also look at the age of the child or the adult that's going back to that activity. Younger kids, the 6, 7, 8-year-old may not go through as much conditioning as an older high school athlete because it's a little bit more play. The types of injuries they're going to suffer are very different. To me, they're kind of like Gumbies. They knock into each other, they fall down, they laugh, they cry, they get back up, and they do it again. And I'd be limping off the field and asking for an ambulance to come. But you take the older individuals, they get older and they mature, their body mass goes up. The amount of physical training and conditioning they need goes up to avoid some of the injuries that the younger kids might not get. So I think looking at that return to conditioning is much more critical in that older athlete, and getting them to condition and look at, I can't go back to bench pressing 300 pounds. I might need to start at 150. The young kid is not going to do that. He's going to play. And I think Sarah's right, spot on with just return to play. Just get back and start doing. And the more structured they are, especially as they get older, that rigid conditioning program needs to be there. But the coach, the mom, the dad, the athlete needs to think of, how much am I doing compared to where I was pre-COVID? I can't jump back into that. If I do, I'm going to get hurt. Do I cut by 50%, 30%, 20, 10? There's different rules out there that people can explore for how one should return to conditioning after a 2-week or more prolonged absence from physical activity, which we've all had.
Katie, I'm going to let you speak and possibly you can incorporate this into your response. And I want us to get a little bit into even on a wider scale about the physiology of how that the body responds to this prolonged inactivity and the type of muscle atrophy that's occurring. And even in some children are actually gaining weight. Like for instance, I had one athlete from March till now has already gained 25 pounds. And what that means to the body system and movement going into sports.
So one thing I was thinking about, and I think we might need to advocate for this group a little bit, is there's also been, because of COVID and because everything is shut down, kids who are asked to play more of a parental role than they would during just a normal school year. And so making sure that those kids we're keeping an eye on them and making sure, if we can, and we might need to help advocate for them a little bit because they've already been asked to do a ton of things. They may not have had a chance because they're babysitting their siblings or again, kind of taking on more of a parent role. Because of the daycares being closed, community, just family groups, being separated, or kind of support groups being more separated. So that's another group I just think we need to be kind of mindful of, and making sure that they are not only having a gradual return to sport, but they're also supported along the way, and feel like we're hearing them. And we understand that it is what it is, and they've been tremendous in what they've done up to this point. Regarding the physiology of sports, this is an area that we deal with all the time. We have people who are, year-round multi-sport athletes who I feel like ACL is the one that we tend to go towards a lot, but like back injuries, knee injuries, shoulder injuries that take them out of sport, and they don't really understand kind of those strength and conditioning components of what is good nutrition, what am I even putting in my body because they haven't had to, what is good sleep hygiene, what is good cardiovascular fitness, what is strengthening, what is this weight, I've only just run a lot, and what is this band or whatever we're using. And so there have been a lot of children's hospitals that have done a great job. There's Group's one of them, and they're doing like either some sort of social media push to try to show kids how to strengthen. There have been programs across the US that are working on conditioning with some of the kids that, again, might be at a little bit higher risk. Maybe they're coming back from a stress fracture, might be at risk for another stress fracture. So there are some groups that are doing it, and I think it's an opportunity that, again, PTs, we've got the information, we have the opportunity. Our acute care colleagues have kind of been taking the brunt of this COVID so far. And this is our opportunity from an outpatient and sports standpoint to really kind of step up and help with moving this forward.
Thank you. We have a question from the audience. Are there any recommendations so far on length of time exercising or playing, team size with return to team sports, or mask use with return to team sports? And maybe James, this might be an opportunity.
Sure. Let me take the mask use because I think that goes across whether it's team sports, individual sports. And I've got a couple of slides that if you want me to share that the audience can take a look at, and we can go from there. So let me see if technologically I can do what we need to do here.
Looks great.
So just exercising with some, COVID-19 precautions, and whether it's COVID-19 or some other influenza type of a situation. WHO has just come out, and here we are in June 16 of 2020. People wear masks while exercising? And their recommendation is not to wear masks when exercising, as they may impede the ability to breathe comfortably. And if you think of this, and if you go online and take a look at some of the stuff that's come out, wearing a mask may be doing a little bit of exercise at altitude, restricting some oxygen intake, having a little CO2 buildup, but it's like exercising at a little bit of altitude. So yeah, if one does exercise in a mask, they want to make sure that, they're not doing something so vigorous that they're having a lot of difficulty breathing, and you can see what happens if a mask gets wet and whatnot. So, doing that as an individual is one thing. Doing it as a team is another, because one of the things that people talk about is social distancing, and this is from the British Medical Journal, and you can go online and you get this. Precautions of wearing a face mask during exercise. It should be breathable and somewhat comfortable. Maintain your social distance, and this is one of the key critical factors. And as you get into a lot of team sports, and I'll look at football right now, that's difficult to do with football. It's difficult to do with wrestling. It's difficult to do with potentially ice hockey or soccer. There are certain things that are harder or easier. If you're cross country, it should be pretty easy, but you still want to make sure that you have that distance. And if you do, you may be able to exercise without the mask and look at where you are. And this goes back to WHO of not exercising while wearing a mask, with being smart. And this handout from British Medical Journal really goes into avoiding touching your face. And it's got some good common sense things of hand hygiene and washing your mask and removing it correctly. So I would certainly urge individuals to be cognizant of the sport that they're in, the intensity of the exercise that they are doing when they're using a mask, or if they're considering a mask or no mask.
Thank you. Katie?
Yeah, one thing, so we watch a lot of soccer here. So one thing, maybe also to make sure that athletes, like high school athletes, they watch professionals and they think whatever the professional's doing, they can do. The English Premier League is social isolating together as a team. So I think that's something just clinicians should know, is that there are some athletes that are playing and conditioning and everything without mask. They're also living in a hotel and haven't seen their family for a really long time. So just to make sure that, you know, you kind of have that information, because I feel like in the clinic, that's something, well, you know, my favorite athlete isn't wearing a mask, so I don't want to. So just so people have that piece of information too.
Would anybody be able to speak to the length of time exercising or playing and the size of the team?
I can speak, I mean, I can speak to the size. As of middle of June, I believe, or beginning of June, I think I mentioned this already, our team sports are limited to 25 people on the field. That it does include, or sorry, excludes refs, coaches, umpires, etc. So that's kind of what we're doing here in Colorado. Parents are allowed to spectate, but they must socially distance on the sideline. And yeah, so that's kind of where that's the max amount right now. As I mentioned before, there are much smaller groups in practice just to limit the amount of exposure. And sports like baseball, where socially distancing is a little bit easier on the field, I think the groups are probably a little bit bigger. So as far as size, I can speak to that as far as what we're doing here. So, yep.
So I'll share to that question that the recommendations from CDC as far as sports participation are concerned is that the longer, they don't have a cap on the time that you can play sports. What we know is that the longer you're together, or what we think we know right now, is that the longer you're together, the longer that you have a risk of spreading it, right? So that's the trade-off. Like, I'm with somebody longer, so now I have longer to interact with them, potentially not social distance, just there's a longer potential for spreading. As far as the size of the team, it was more dependent on the location of where you are practicing and or playing. Can you safely implement the recommended guidelines, particularly with social distancing? So if you can social distance and you have 100 square feet, then you take that 100 square feet and do the math, like, can we spread out? Now, certain sports like basketball or contact sports, you don't have that ability, but right now there are no number guidelines from CDC. Yes, Katie.
I would say also, we can't forget that this is an extremely contagious, deadly disease. So, I mean, it's also, I would say probably it's the smallest that you can, the most socially distanced, the least exposure. We're still kind of in that phase that we need to be mindful and protective of the people we're around. And if you were to be diagnosed with COVID, and you were to have to contact anybody you were around in the past couple of weeks, you know, could you do it? And so I think we just need to make sure that we're mindful of the fact that we do not want to spread this disease. It takes out families. Like, you do not want to be calling, you know, the whole family of one of your athletes. So just to be mindful of, we do, sports are good, they're important, but we also need to make sure we're not losing that picture of COVID is very contagious and very deadly.
What are any of your thoughts on screening athletes and or coaches for signs and symptoms of the coronavirus before practice and or play?
We do it every day for my daughter's daycare. So they do the screening question and they take the kid's temperature every single day. I think if you can, it depends on the community, the resources, and if you can do it. Baseball, I think, is having people, I forget how often they're tested. I could look it up. They're testing pretty frequently.
I think one of the things you've got to think about is the group. If you're looking at high school athletes, you know, who's doing the screening? Is it mom, dad, the coaches, the athletic trainer, the nurse? You know, I know as an employee at Brigham and Women's, I have to screen myself and attest to that on an app every day. There are apps that are being developed by high school students and teams so that they can screen and attest relative to were they healthy this day, cough, fever, cold, sniffles, shortness of breath, muscle aches, all the symptoms of COVID, and then go forward. I think we need to be diligent about that as individuals, and parents need to be diligent about that as their kids, that, you know, I'm not going to send you to practice today. And then the coach has to be okay with this. And I think this is where the pressure comes. Pressure comes from the kids, pressure comes from the coach. You know, yes, you can play. And one of my colleagues here at Brigham, you know, talked about the Michael Jordan flu game, you know, that he participated in Chicago and was, you know, extremely ill with the flu. Would that fly now in the pros? Would that fly? Should it fly? Would it fly at high school? We all know kids who, you know, quote unquote, sucked it up during the game, went to class because they had a game that night and they wanted to play in the game. Would they have gone to class otherwise? No, but they wanted to play in the game, not to let their teammates down or suffer the wrath of the coach. So I think this is a whole new era that we're in about individual accountability and a group accountability. You know, will the captains and the coaches step up and say, it's okay if you're the star of the team and you're not feeling well and you have these symptoms, I don't want you here. And this is a whole culture shift for us in sport, as we've seen throughout the country, of who's wearing a mask, who's not wearing a mask. It's a culture shift of a shared responsibility. And the coaches and the captains can lead the way if they so choose.
Can I say something real quick?
Yes.
I 110% agree with that. And I think something that we're going to need to be aware of moving forward is if there potential of a stigma associated with either having had COVID or being exposed to it or not wanting to participate because of being afraid of it. And I think when it comes to high school, I mean, it comes to anybody. We need to be aware of the mental health aspect of that too, or the potential of a kid being bullied for not wanting to participate or having had COVID. And so I think mental health and resources for kids moving forward will be really important, so that they know that it's okay, that one, if you don't want to participate for your health, or that it's okay that you had it, or it's okay you know someone that had it, it's okay kind of thing. So I think mental health is something we can't forget about. I mean, physically, really important, but mental health as well as we move forward with this. So,
Katie, can you talk to us about what are some of the different considerations as we're talking about masking, social distancing, for people who have disabilities, whether they're intellectual or physical? Because some of them may need a person with them to guide, or a helper or an aid. So what are some of the considerations that we need to be thinking about as therapists and or coaches, athletes, and parents, as far as allowing other people into the specter of the playing sports?
Right. So it's very, very, very similar. If not, it should be pretty much the same as able-bodied sports, where you need to make sure that the athlete has a voice, that you're considering everyone of risk factors, because even for able-bodied athletics, kids that have asthma are going to be at an increased risk. Kids that have any sort of clotting disorder, kids that may have had COVID but don't know, or really, I feel like we're seeing this much more in adults, but you might be seeing other symptoms down the line that you just may not expect. So I think we need to be a little bit more on a higher alert for everyone, not just people with disabilities or anything like that. For individuals with disabilities who have somebody that helps, it's typically somebody that they know well, and it's usually a family member or a close friend that's doing most of the assistance in any sort of environment. Volunteers are going to be the same as any sort of spectators, where we need to minimize risk as much as possible. So really, I would see it as more of, if you were to have a volunteer or a coach, what would you expect from that person? They're going to have very similar kind of close contact as somebody who's helping an athlete with a physical impairment or an intellectual impairment. It's going to be very, very similar. So I think, and the other thing is we've seen this with the US Open. They were not going to have wheelchair basketball this year. And they did not talk to any of the athletes. They didn't consult them at all. And we'll just say the US Open has both now. You cannot discriminate and make it so that one group can play and another group can't without consulting and getting them on board. So whatever is in place for athletics needs to be appropriate really for everyone. And you need to be talking to all of the groups. I don't know if they answered it well enough, but let me know if you have another.
Definitely did. Definitely did. Another question I would like to ask you is, what do coaches and parents need to look out for when their kids or athletes are returning to sports? And further, how do they differentiate between usual difficulty breathing and coronavirus symptoms like coughing, right? So you're running and you're coughing, and how do they start to piece these out?
Do you want me to answer, or does somebody else want to take it first?
Go.
Okay.
Go for it.
So I talked to my sister who's in med peds, and I was like, how do you know? She said, if you have a symptom, go get checked. So if you have a symptom, go get checked. You do not want to risk taking your entire team out with you because everybody has COVID. So especially as things are starting, schools are opening, there's more community engagement. I think we need to take this slow. We are not even through the first wave. And so we need to be mindful and I think more cautious than we really have had to be with sports, and make sure that we're not putting people at risk.
Thank you. Any other thoughts?
I was just going to say, as far as what parents and coaches should be aware of, and it's not much different than if you're just returning after an off season or something like that, but signs of dehydration, signs of heat illness, it's really hot here right now in Colorado, like really hot. And there are some tryouts and there are some leagues picking back up. So making sure that parents and coaches know what to look for as far as, that kid's not okay right now. That kid needs to take a break. We need to take a water break. Everyone needs to drink, this much water and have some Gatorade if, we're going a really long time. So things like that, while they're always important, after this prolonged period of inactivity and it's summer, will be extra important.
I would also say I forgot to mention this, maybe call a couple clinics in your area that do testing so you know what the rules are. There are some groups here that you can't get a test for a week, which potentially having COVID for a week is, I don't know, that's really rough, and before getting even tested. There are some walk-in clinics. There are some clinics that you have to pay. There are some clinics that go under insurance. So knowing what's in your community and what the resources are before the season even starts is part of being a healthcare provider. So this might be a good time to have people make some calls so you know what's available in your area before the season even starts.
Yeah, and I would echo that, Katie. Not all places will accept somebody. Not all urgent care walk-in centers or clinics will accept somebody with COVID symptoms, because they're a COVID-free facility, because for other purposes with other patients. So I think that's prudent to have, especially if you're working with a team, to have that understanding of where can I send this individual, or where can I send this patient or child or adult that's giving me these new symptoms. And we need to remember that viral transmission for COVID starts 2 days pre-symptom, and it goes for 5 to 7 days post-symptom onset. After that, there's much less transmission. So we need to think of that if you're hearing of this individual cough, difficulty breathing, has some of the symptoms that one might think of COVID, you also need to talk to them and educate them, or the parents or whoever, go back 48 hours. Who were they in contact with? Because if they've been shedding, they've started shedding 48 hours before symptom onset. And I think that's a real prudent thing for any healthcare professional, physical therapist, physician, athletic trainer, nutritionist, to have that understanding of that it's not just now, it's what's that window with which they could transmit the disease.
And Zach, for those who might not know or aren't as familiar with shedding, can you explain for us what that terminology refers to?
Sure. That where their symptoms, their particulate matter, and 85% of COVID is shed through airborne particles, droplets, aerosolized saliva, if you will, from coughing, sneezing, yelling, exerting a high volume of expiration and having some sort of forced expiratory aspect, which you might see with exercise. So that's that transmission. So they're shedding. They're putting this out in the atmosphere for somebody to pick up, or if they're touching something, there's about a 10% viral transmission from surfaces, thus hand sanitizer, thus Clorox wipes, thus some sort of spray disinfectant where you're disinfecting the surface. That's about a 10% transmission versus the 85 that's from aerosolized matter. So yes, they're shedding. They're leaving this behind as if a cat or a dog would shed fur. It's behind. It's been left behind. I'm not comparing them to cats or dogs. Please don't get me wrong here.
Thank you. So are any of you aware of, or do you have protocols at your facilities for sports participation for individuals with or without disabilities, athletes, or protocols for the staff or the assistants?
Protocol regarding what?
Protocols regarding safety for COVID-19 while in anticipation of participation in the sport or activity.
AAP has it for returning to schools, and I think if you have any kids that are participating on school sports, that should be followed. So that restricts any sort of travel. It's social distancing. It's wearing a mask. It's really that's going to be hard to do sports, to do sporting activities, but that one is, I think, well done. And it seems that they're trying to get a couple things out for sports-specific things soon. So
remind us what AAP.
American Academy of Pediatrics.
Thank you.
So they have a document out it's specific to schools right now, how to return to classes, but pretty much every single policy on that applies to sports. And then National Strength and Conditioning Association had things for gyms that I saw.
And then the only other thing I'll add, the Aspen Institute has a return to play COVID-19 risk assessment tool that they put out. And I think I provided a link to that. It basically goes through tons of activities and lists out what lowest risk, medium risk, or highest risk would be if you're going to participate in those activities. So I think it's a really good resource, at least if you want ideas of, if you play tennis and you're like, what is the low risk tennis activity that I could do? Stuff like that. So Aspen Institute came out with that also.
I think, COVID's caught everybody by surprise. Didn't know it was there. There's a lot of things that didn't exist, still don't exist, and people are in the process of scrambling and developing. And I think most associations are beginning to pull this stuff together. The National Federation of High School Coaches has come up with some guidelines. So I think I would look at the groups that you typically would and see what their guidelines are, and then extend out from there. American College of Sports Medicine, Corey Stringer Institute. I know that we at Brigham are working very diligently with the coaches in Massachusetts and the folks that we have under contract that we provide physician services, athletic training, and PT services for, of developing policies and procedures and infection control policy. These exist in hospitals. They don't exist in schools. They don't exist in athletic training facilities, athletic healthcare venues, or for groups, team sports. They don't exist. And hopefully they will as time goes on. And these standards are now just being developed at a national level that can then come down to a regional, local, youth level. So they're in the process, but there are resources out there that one can begin to look at, but you have to hunt them down. They have not been easy to find. I know Sarah's been hunting, Katie's been hunting, I've been hunting. We all have our sources, but there's no one Bible to go to and say, here it is, because none of us expected this pandemic. And if we look at this, COVID is an influenza that's fairly easy to kill in comparison to H1N1, norovirus, those types of things. Soap and water and washing your hands works wonders. But we didn't expect that. But what we do now for control of COVID as a type of influenza will only also help other types of influenzas that we typically would have during the year. So it goes without saying, we are learning, we will benefit, but we've paid a heavy price for this education.
I would also add just one thing. So COVID, everything that everybody has said, but COVID's also only like 6 months old. So like the fact that we're still learning a lot, even if you have policies in place, you might have to change them next month. I mean, it's just the way it is. So I think it's hard because we want an answer. We want it yesterday or 3 months ago or 6 months ago. And this is just really a time where we're so used to having information at our fingertips, and that's great. But this information is going to keep evolving and changing, and we need to stay up on what is the recommendation now. And I think this is the first time, I know that I have had any sort of situation where I've had to, information's changing weekly. And so I think that that's something that whenever things are, you're starting into the sports season or whatnot, just be we're going to have to kind of modify as we go. It's just the way it is. We're learning new things every week.
That's a great segue into the next question from the audience, which is, there are generalized recommendations for screening for COVID right now, like cough, difficulty breathing, diarrhea, etc. But the symptom list keeps evolving. How much active monitoring of other symptoms should we be doing, or are you doing?
I think that fever is the biggest one. So I forget what the percentage is, but if you have a fever, it's high that you are at risk for it. And then most of the screenings kind of go from most severe to not quite as high of likelihood that you have it. But I'll kind of leave it to the other two, to what you guys think.
I'm not sure how relevant this is, but I do know, so before I go to work every day, we have to fill out we are screened, and the symptom list is updated with the updated symptoms. So it is being monitored, at least, I can speak to children's. And then that kind of helps me also keep track of the new symptoms if I, missed some things. Like Katie said, the news is changing all the time. So it's really challenged me to keep up on current guidelines, which has been, it's been fun. It's been a learning experience, but I will say, that's a way that I do try and stay informed, because I look at it every day before I go into work. So, yeah.
I concur. I think we're all attesting in some manner, shape, or form. And it goes back to that. And whether it's an app that the school develops or an app that the parents come up with, it's looking at, and when the screening is happening, at least the question we're being asked is new symptoms. Are these new? And I think we've got to be able, and this is where you've got to have some trust in the parent, the child, the individual, are these new symptoms, or are these, it's that time of year and my allergies are kicking up a storm, because come April 15th and I have a huge allergy to ragweed, I can guarantee you I'm going to sneeze, I'm going to cough, I'm going to have a runny nose, I'm going to have all those things. But I know the timing of that is once ragweed season hits here in New England. So I think I've got to be able to differentiate out. And it may well be, as you said, Katie, that your sister said, when in doubt, go get tested. And hopefully the tests will be more prevalent and easier to come by than they are now, because they still are not easy. You can't just walk in everywhere and say, test me today. I want to get tested tomorrow. I want to get tested every day just in case. So we've got to use some common sense and again, have this shared sense of responsibility of saying, are you sure this is your allergy?
Thank you. So I want to ask a question, but James, I'd also like you to share maybe the last two slides from your deck. And you touched on something that I think is always related to sports, and that's access, right? So you talked about the access to actual having tested. Do the communities in which you live in or go seek care have actual testing available, and the access to actually playing sports has been changed? So do you think, what are your thoughts on how the coronavirus has contributed to either positively or negatively to the healthcare and access and disparities that we see that are related to sports, right? So do you think that people who have difficulty accessing sports and testing are less likely to get the care they need, or do you have concern for some kids more than others because they live in certain places, and even if you see the symptom, you don't know that they're going to actually get tested?
I can speak to that in the aspect of sports. So the Aspen Institute found that only 22% of children from homes of incomes under $25,000 a year play sports, and as compared to 43% of kids who come from houses with incomes greater than $100,000 a year. So that's a pretty big difference already. And then when you add in potential loss of job from parent or decreased income, affordability of sports may become very difficult for a lot of families. So I think access to sport, especially in low income neighborhoods or in families that have lost jobs, will be hard. In addition, you might have older kids who have stepped up to try to help their families and gotten jobs. And so then they may have less time for sport now. So I think those are things that we can't lose sight of right now. So I think COVID-19 will definitely affect access to sport in the long run. So we need to be mindful of that.
Thank you. So Zach, if you could share your last two slides and then we'll come back from closing remarks.
These are, I think these are relative to coaches, groups, youth sports, high school sports, any kind of organized activity in sport. And this is a brand new textbook that came out came out May 26th of this year. And I think I got my copy June 1st. First time I've seen something like this published. It's by a physician who's an infectious disease doc on infection prevention and athletics. And it's about a 200 and some odd page spiral-bound book. So it's fairly easy to look at, and it's pretty straightforward with some common sense things. But they talk about things like, if you've got a facility, where do you put hand sanitizer, soap dispensers? What are the behaviors of different players, or what are the behaviors, what's the risk, and what are recommendations for how to mitigate infection? And this is based upon their experience with NFL teams and colleges in doing this for a living. So it's a great resource text that I would certainly strongly urge camp operators, folks who run youth sports leagues, groups, teams, etc. It's $50. So this is not expensive. And I think it's a great way to look at how does my team, my facility, how does what we're doing measure up for controlling infection? Kind of one of the other slides in the graphics out of this is really kind of puts the athlete at the center, and what's the direct impact on the athlete from personal behaviors and facilities, and what's an indirect aspect, and this is where it goes from one to the other. So all of these can be further defined out and looked at for the athletic training room or the athlete, the weight room. How do we do that? How do we minimize infection? Did you wash your hands? You know, has the treatment table been disinfected? You know, have you wiped down the equipment after you used it, before you used it? How heavy is the cleaning? I think, you know, there's been a lot of negative impacts of COVID on athletics and organized athletics. One of the positives, if there's any positives that will come out of COVID, is it's made us all, from a healthcare environment, and I think from an organized athletic school environment, looked at how do we control infection? How do we manage infection in that setting? We know we have standards in the clinic. These same standards for cleanliness, hygiene, infection control should be in an athletic training or an athletic healthcare center, in the weight room, in the locker room. You know, how do we think of this with the school bus? You know, are we sharing water bottles? How are we cleaning coolers? So it's made us really do a double take on things that we took for granted before, and I think we can no longer take for granted. So it's made us all up our game.
Thank you, Zach. And I would be remiss not to, in addition to thanking you all as panelists before we go into our closing remarks, to thank the Academy of Sports Physical Therapy for partnering with APTA and providing this very informative discussion today. So thank you. And I'll have you each give some remarks on what you think we should do going forward and where you think we might be next year. And I'll start with you, Sarah.
So, I mean, I think like we've mentioned, this is a very new and changing situation daily. And so I think the best thing that we can do right now is just to try to stay informed, and keep in mind that the most important aspect right now is the health and safety of the athlete, the parent, the coach, everyone involved in sport. So I think moving forwards, just stay informed. Create relationships with the athletic trainers in your community, the strength and conditioning professionals in your community, because we're all in this together. And so I think if we do this in a safe but systematic way, sports, may or may not be possible this fall, but next year, let's hope that we're in a different place, but that we don't lose sight of, all the things we've learned from this situation. So, yeah.
Thank you, Sarah. Katie.
So I just want to say thank you. First of all, I think this was great. It was informative for me. So thank you all for sharing your knowledge and for this opportunity from the APTA. I think the big thing with COVID that we need to kind of think about and remember is that we've already seen it split and kind of make socioeconomic divides worse in a lot of areas. And we've even seen in sports who are in a little bit more of affluent areas are getting to sports sooner and having more opportunities to be active and physically active sooner. So groups that have historically been marginalized are going to be at higher risk to have decreased participation moving forward this year. And so that's not just socioeconomic, that's also individuals with disabilities, that's individuals who maybe aren't the star of their team, and just kids that maybe aren't sporty. So there's a lot of groups that right now I think need our attention, and especially with public parks being closed, school facilities not being open, like there's a lot of things that have really kind of these kids have taken a big hit, and just a lot of their childhood this year has been kind of taken away from them. So I think, however, this is our opportunity as PTs to really, we say that we're working on prevention, we're promoting physical activity. This really is an opportunity for us to say, this is who we are, this is what we do. And this is, our role in our communities. So like what Sarah was saying, connecting to schools, connecting to physical education teachers would be really important. Getting it so that, and then I think the biggest thing is, how do we put the fun back into sport? It's not all about competition. It's not all about, you know, winning the state or going across the country. Those are wonderful things and elements of sport. But right now, how do we kind of take it where we are right now, and how do we put it fun and just focus on it is fun, and we need to be promoting physical activity, not just in the athletes who have been having opportunities to do things, but for everyone. And again, I think this is really a great opportunity for PT to, and really all healthcare providers to step up in our communities and help out.
Thank you so much, Katie. Zach?
I think in conclusion, I'd like to thank APTA and Sarah and Katie for being part of this, allowing me to be there with everybody. This is something that I think we can all learn from. I think everybody's beginning to come together on a health provider basis, whether you're a physician, a nurse, athletic trainer, physical therapist, respiratory therapist, et cetera, to battle this. I think the last takeaways I would say to those who are listening that have themselves are athletes or parents of athletes, parents of kids, is reach out to the professionals that you trust. See what they've got to come up with. Katie's right. We are learning. This virus is evolving. It may mutate 6 months from now, and all the symptoms are going to be different. We're going to have to change the rule book and the playbook. But in order for us to get back to the new normal, or develop a new normal, it will take a shared responsibility. That's one of the things I'd emphasize, is we do have to share that. And I'd echo Charlie Baker, who's the governor of Massachusetts, his words. And when asked, how do we get back to normal? How do we progress to the next phase? He had 3 words: follow the rules. Follow the rules of the CDC, follow the rules of the healthcare providers, follow the rules that people develop and are laid down. They're developed by knowledgeable people that have your interests at heart. So I would say, in conclusion, everything we've said, everything you learn, follow the rules, and we will get out of this together.
It has truly been an honor and pleasure talking with you all this afternoon, and I look forward to your individual works in the future. And thank you so much to you and the Academy of Sports Physical Therapy and APTA for giving us this platform to speak on something that's near and dear to all of us. Have a great rest of your day.
Thank you. Be safe.